I'm with Professor Miles Fisher. So Miles, a lot of people that deal with patients with vascular disease almost feel that diabetes is a separate category and somebody else is responsible for it. So they don't really pay much attention to it. I mean, what's your attitude to that, and where should the NHS be going to make sure that we deliver a good deal for people with diabetes?
Well, it's correct that people with diabetes have a doubling of cardiovascular risk. In the past, we used to see it particularly in the form of heart attacks, myocardial infarction. Now, particularly, we're seeing it in the form of heart failure and strokes, and also an increase in peripheral arterial disease. So it's a complication and a problem that affects multiple specialties. Once we start to think about what we can do to reduce the risk, the things that are known in the past to do that well are treating blood pressure and treating cholesterol. So it's really the same approach as to anyone that's got vascular risk. In the past, the tools that we had and the drugs that we had to treat the diabetes were not so efficient, but we now have 2 or 3 new classes of drugs, and 2 of them in particular seem to give us additional cardiovascular benefits.
Yeah, I think for a lot of physicians, suddenly the world of diabetic drugs has transformed, and there used to be very few you had to know about, and now suddenly there's this huge long list of different drugs, different actions, etc. But for you, what are the two or three most exciting new drugs in terms of cardiovascular risk?
The most exciting drugs, there's 2 classes that are exciting from a cardiovascular perspective. The oral tablets called SGLT2 inhibitors and the injected therapy called GLP-1 receptor agonists. Now, with SGLT2 inhibitors, empagliflozin and canagliflozin have both been shown to reduce MACE, major adverse cardiovascular events, but also reduce hospitalization for heart failure. So that's exciting, and in fact, these drugs have been tested in non-diabetes heart failure populations just now. The GLP-1 receptor agonist is particularly the one called liraglutide that seems to give clear benefit. The mechanism of benefit is probably different from the SGLT2 inhibitors. So then that leads us to, should we in selected patients be combining these 2 different types of drugs to maximally reduce cardiovascular risk?
And what's the best way, just finally, for physicians to keep up to date with diabetes, the diabetes world, how medication combinations are going? I mean, Diabetes UK runs an annual meeting. Are there web resources? So what's the best way to keep up to date?
Yeah, there are web resources. Nowadays, there's a lot of diabetes sessions at, say, general cardiology meetings because it's become such a hot topic. It's extensively covered in the standard medical journals like the New England Journal, Lancet and BMJ, and there's lots of web resources as well. So the material is out there, yeah.
Thank you. Sounds like diabetes is in a very exciting place at the moment.
It is indeed.
Professor Fisher, thank you very much indeed.
Thank you.